Hi, everybody. Dr. Jake here. And I have a story to tell you. This is a story about someone who's dealing with shoulder, particularly frozen shoulder. So, if this condition is something that you have been suffering from, then pay attention. So, this young lady, she was mid 50s, came into the office, said that she was losing her range of motion in her shoulder for the past 4 or 5 months. Now, this young lady, she's very active. She works out, she runs. And so this was really concerning for her because she's never had any issues with this before. In addition, the shoulder was painful as it was occurring, so she was avoiding doing certain things. And as she was avoiding doing certain things, she noticed that her range of motion diminished even further, to the point now where she had a hard time combing her hair, putting on a jacket. Sometimes her husband had to help her with putting on a shirt on that side, which that's, as a grown adult, no one wants that to be the case. And we started her on shockwave therapy. Now, shockwave was able to break up the adhesion. So, frozen shoulder is more that adhesive capsulitis, which means that those tissues are tightening up. There actually could be calcifications that are occurring within the joint, which is limiting range of motion. And the only way to prevent that from getting worse is create more range of motion. Now, how do you do that if it's happening within the joint? Shockwave therapy was able to penetrate deep and break up the scar tissue that was developing, even decrease the calcifications that were there. And so she came in her first treatment, not knowing what to expect. Now, I got to be honest, this wasn't her favorite treatment during, because I also had to push for more range of motion. But afterwards, she was able to lift her hand up and over her head. She was able to put on her coats without any issues. That's just one treatment. And so it gave her hope. Now, we did an evaluation again the following week and considered to do 8 visits once a week, so an 8-week program. And each time, the treatment actually compounded on itself. So she found herself getting more and more range of motion after each visit. Her pain level almost diminished after the 3rd visit. And while we're doing this, I was making sure that she had specific exercises to turn on what I call stupid muscles, making sure that when she does get full range of motion, she also has a good foundation to prevent this from occurring. Now, after the 8th visit, 8th treatment, she had probably 90 to 95% range of motion back. And I made sure that she had the tools to maintain all the success that she made. And this was some time ago. And so I've checked in with her, and she's remained about 85% of her range of motion is still there. Considering how chronic and how debilitating it was, I would say that that's a success story. And so if you're dealing with frozen shoulder, if you're dealing with chronic pain, then consider shockwave therapy. It might be the treatment for you. Thanks, guys. I love you. See you in the clinic.